once someone is in detox, then you also have the program, right? So like say you stay in touch with them, you have the release form signed, you have the plan of action. Your next step is actually getting them into a program. This is where programs vary. And honestly, there's no way on earth for me to cover every single process for every single program in terms of their restrictions and everything. I'm happy to give you whatever information I have sort of on another time. But remember, so for instance, you have a lot of programs. So like the Bowery mission, New York City Rescue Mission are two of the primary programs that are Christ-centered, where people can do long-term rehabilitation going forward once they've completed a detox. So those two are sort of a really good, they're both, we, as an organization, as like Don't Walk By, for example, they are partners in this effort. So they are the ones that will do long-term care once the person goes in detox, once they does an intake. There are intake people at these programs. So you can't, again, you're not just going to walk them in the front door and drop them off at the desk. I mean, again, you can do that and they'll help navigate that, but it's far better to actually call the person in question. So just for example, I'll give you a couple names right off the top. I don't think they're in the paperwork, but so if you're going to the Bowery, you're going to want to talk to Pastor Julian or someone in intake in their office. I know there are a couple people that do intakes. With New York City Rescue Mission, you want to talk to Scott Abbott, or you want to talk to Timothy. There's another guy who's in their intake, or you can ask for someone in intake for their program. You want to talk to these folks to actually get them to get connected to the person you're trying to refer. Again, if they're already in detox, it helps to say this person is in detox already. They need a program next. Who can I talk to? Can we set up an appointment for you to get them connected? Once they're in, again, the differences are vast. One thing you can do, this is maybe something that I don't know a lot of people knew you could do this, and maybe you can't, but I do it anyway, is I will even offer to have people go to these programs and check them out first. We're talking about a situation where this person might be investing 6 months to a year of their life in this program. It's not the end of the world. It's actually probably better that you go with them, meet them at the Bowery, at the Rescue Mission, or at the program that you're sending them to, and actually have them check out the place, have them walk through, have them meet the people, have them introduce them to the pastor, introduce them to the people there, have them ask the questions. I mean, this is not a crazy thing because this person is considered, if the person is willing to go to that trouble to actually get into a program, your odds of them succeeding in that program, I'm convinced, skyrocket. Like if you can actually get someone to meet you there and actually walk through the program and actually meet the people that are running the program, that person is someone who I would bet they're very, very serious about going and are much more likely to succeed in that program. So that's another thing you can do. Again, we don't have the capacity to do that with everyone we see, obviously, but if you're working with someone that you met on the street, for example, or someone you met at Don't Walk By, and you pass them on, I'm going to work every day, you can say, what have you got to lose? Let's go check it out. Let's go see what this, let me introduce you to someone. Because the other problem is that it's oftentimes as a referrer, there's got to be a better word for that, as a person who refers people, when you send someone to a place where you're not there to meet them, or you don't have a specific person waiting for them, they may bump into someone else. And that someone else may not be quite as receptive or welcoming. I've even sent people to programs and they've met someone in the lobby who was getting kicked out of the program at that very moment. And they're saying, guess what? Not very nice things about the program. So if you don't take control of that situation, you might be setting someone up for failure because they might go to the program, bump into someone at the door who's disgruntled and who was just kicked out because they were drinking or using drugs or fighting someone, and they got kicked out for a good reason. But now you're meeting them, and they're telling your guy that this place is hell, and that you shouldn't go there. Don't trust these people are awful. And now you're screwed because this guy just blew up everything you had hoped for this person getting into the program. So if you can go with them, it's way better because you'd be like, yo, just forget about that guy. Come on, let me. I know he's mad. I know he's not like it. Just forget about that guy. Don't listen to him. He's obviously upset about something else. Let's go meet the pastor and see what's really going on. And you can kind of play like fullback in that situation to kind of let the person kind of come in behind you so that it's not as chaotic. And again, there's so many thousands of variables that would stop someone. Everyone that goes into these programs, honestly, again, you're fighting, the best terminology I've heard is someone's fighting addiction is stinking thinking. Basically everything in their brain is telling them to run and to go use. Everything they've trained their brain to do is run and go use. So if they can find the slightest reason to not go, guess what? They're not going to go. So you got to kind of navigate that in terms of balance of is this person ready for the program versus is this person going to get knocked off because there's a disgruntled person at the door, or even someone on staff. I mean, again, we all have bad days, right? So like you go to a restaurant and the person at the desk, like the host or whatever, like is really rude and snooty towards you. You may never go to that restaurant again. You may tell your friends, we're not going to that restaurant. The host person was a jerk. The problem is maybe that was the host's last day, and maybe that everyone else in the restaurant is like gold, but because you had that bad experience with the person at the table, at the host stand, like it ends up chasing you away. It's the same thing with a program. If someone walks in and they meet someone at the desk who's on staff or who works the program, who's having a really bad day and just treats them kind of impatiently, that can be a problem. So if you can kind of walk them through, like, okay, let's persevere. Let's remember it's about you, it's not about them. That kind of thing. You can actually help them get more successfully into a program that works. Is anybody else? Yes, sir.
So
thank you.
For these programs, it requires that the person already has some type of insurance, right?
No, not the Christian program. The detoxes, yes.
Detox.
Yes.
I'm sorry, I meant the detox.
Yeah. Detoxes, now there's some exceptions. The exception for that would be Project Renewal is a detox down on 8th Street in Lower Manhattan. And then BRC is another one on 25th Street. Those are detoxes that do not require Medicaid or ID of any kind. They will help someone get signed up for benefits once they're there, but they don't require it upon intake. They also do, I know Project Renewal does this, I was reading over our paperwork. BRC says on our paperwork it says they do, but I'm not 100% convinced they do. But Project Renewal I know does opiate detox. They prescribe medication, Suboxone, to help people wean off of, so they don't go cold turkey and risk really significant health issues. But they will only do detox for opiates Monday to Friday. So again, if you meet someone on Saturday or Sunday who needs detox for opiates and they don't have any ID, they're going to have to wait till Monday or go into an emergency room.
So that would be the option that if they don't have insurance, they have
Correct.
to go to emergency room.
Correct. Or if it's a Monday to Friday, 9 to 5, they can do Project Renewal.
And so was there a second one?
BRC. Yeah. Now, I would call first BRC. Because again, my brain's kind of fried these days. Our paperwork says they do opiate detox, like a medically supervised detox, and they might. But again, I'm sure it's a situation where they would do Monday to Friday. Because again, to do an opiate detox, you have to have physicians. And if you're going to have physicians there, their physicians don't work on the weekends. So,
anyone else need or want a quick break?
yeah, this would be an optimum time
Perfect.
for a 10-minute break if you want. Or I can just blaze through.
Quick break? Okay. All right.
All right.
I mean, the camera just shut down? Yeah.